through saliva or respiratory droplets. Additionally, a pregnant person can spread the virus to the fetus through the placenta. We don't know if the virus can be present in semen or vaginal fluids. Monkeypox has not been shown, though, to be spread through casual contacts, such as being in the same area, having casual conversation, or briefly touching shared items like doorknobs and things like that.
Okay, that was actually going to be my next question, because when we were talking about when the COVID virus first started, I know that was one of the things that a lot of people had questions about is, if I touch a surface that somebody else touched, could I get the virus? So it's good to hear that that's not necessarily the case with monkeypox. I know one of the things when it came to COVID, everybody was disinfecting and cleaning everything. Talking about that transmission, is that something that we need to be doing as well?
Yes, we still want to be disinfecting and washing our hands. So when it comes to monkeypox, monkeypox infections and things like that, and transmission, it can be spread through the blisters, through the sores. As I said, monkeypox, though, is not a sexually transmitted infection. So it's not considered an STI. If you have had sex with someone in the past 14 days and are experiencing new symptoms, you should want to seek STI screening from your healthcare provider or our local health department. We do not know if monkeypox is found in semen or vaginal fluid or feces. Condoms can provide protection against sexually transmitted infections, as we know, but they may not prevent the spread of monkeypox.
Now, for a lot of people, monkeypox is a new virus. It's something that we have never heard of or experienced before. So when it comes to the virus, I know a lot of people want to know, how serious is it? Is it really as serious as we're making it out to be, or is it something that we can kind of just casually not have to worry about?
Well, so the monkeypox, it is a rare disease. The monkeypox infection, though, it can make you sick, okay? And typically symptoms begin like a fever, headache, muscle aches, exhaustion, which appear between 5 to 21 days after the individual is infected. Often within 1 to 3 days of the onset of fever, infected individuals develop a rash that can look like pimples or sores or blisters. The rash may appear on the face before spreading to other parts of the body, including the hands, feet, and genitals. As I said, though, monkeypox is rarely fatal. For the general public, the current risk of getting monkeypox is generally low.
So we shouldn't be super worried about.
Not super worried.
What do we know about who is most impacted by monkeypox?
Good question. So recent cases have been reported more frequently among gay, bisexual, and other men who have sex with men and who may have had multiple or unknown sexual partners. As of 9/30, so this past month, the end of this past month, September, of the 81 cases in Montgomery County, around 60.6% have been between the ages of 30 to 39. 18.5% have been between 20 and 29. 17.3% have been between 40 and 49. 95.1% of them have been male. 28.4% have been Black. 23.5% have been white. 27.2% have been Hispanic. And around 34.6% did not complete the question, so we're unknown.
Okay. And just a reminder to everybody watching right now, if you do have any questions, this is a fluid conversation and we want you to participate. So drop some questions down in the chat and we will make sure that we get those questions answered for you. Where exactly did monkeypox come from? A lot of people say, and we've heard the rumors and what people have said came from a monkey. Let's clear that up right now. Where did monkeypox come from?
Well, the first case of monkeypox was actually recorded in 1970. But since then, the monkeypox has been reported in several other Central and West African countries. Prior to the current outbreak, nearly all the monkeypox cases were people outside of Africa, were linked to international travels in countries where the disease commonly occurs, or through imported animals. It can infect any animal. It's not necessarily related to, has to be monkeys.
Thank you for clearing that up. That is something I'm sure a lot of people have heard, and kind of just wanted to dispel the myths and the rumors around it. Because again, we are here to educate everybody watching. Dr. Myers, thank you so much. I want to switch gears just a little bit and talk to Dr. Townsend. Dr. Townsend, how are you doing right now?
Good evening. How are you?
I am well. Thank you for joining. What do you do if you think you are sick with monkeypox or that you have been exposed?
So if you think you've been exposed or you're having symptoms of monkeypox, the first thing you want to do is stay at home and contact your primary care provider or your healthcare provider. If you're unable to stay away from others in the home, it's a good idea to cover all exposed areas and wear a well-fitting mask. Try to avoid close contact. When you do contact your healthcare provider, that person will be able to provide you with a medical evaluation, help you manage your symptoms, and if it's appropriate, arrange for testing as well. Currently, just in terms of testing, it's only for people that are having symptoms. There's not testing for people that are asymptomatic. If you do receive testing and you're waiting for your results, it's advised that you continue to stay at home until your healthcare provider contacts you with those results and provides additional guidance for you. We just like to let people know if you don't have a healthcare provider, you can go to a community provider, such as an urgent care center. If you need assistance with identifying a place that you can get service, you're welcome to contact us at our call center, and that number is 240-777-2982.
You mentioned once you have received a test that you should stay at home. If you are, or if you find out that you do have monkeypox, what's the actual quarantine period? Or is there a quarantine period?
So there's a period of time that it's recommended that you stay at home or isolated or away from others. And that can depend on the person. It's advised until all the scabbing or crusts on your lesions have healed, fallen off, and have been replaced with new skin. For some people, that can be 2 weeks, and for others, it can be 4 weeks. So it's generally between 2 to 4 weeks that a person would stay home.
Okay. I saw that we may have a question. If an older adult got the smallpox vaccine, do they need to get the monkeypox vaccine?
So that's a good question. It is thought that people that have previously been vaccinated may have a small amount of protection from MPX. However, right now, vaccination for MPX is being offered to specific groups that are at greatest risk.
If you have had chickenpox in the past, do you still need to get the monkeypox vaccine? And is there a possibility that you could get monkeypox?
So MPX is different from chickenpox. And right now, vaccination is not recommended for general populations. There are particular populations or groups at greatest risk that are recommended for vaccine.
Okay. Let's talk about the vaccines just a little bit more. What's the guidance around vaccines right now?
So the guidance right now is that it's offered to people that are the groups that I mentioned at highest risk. And right now, those groups include people that have been exposed to an individual with MPX or have likely been exposed. Also with persons with multiple known or unknown sexual partners. We are giving priority to those that are at highest risk, those that are disproportionately affected or impacted, and those that have suppressed immune systems.
Okay. Intradermal or injections, can we get into that a little bit more? I know I've been hearing a lot about that on the news. So just kind of want to, one, what is it? And then two, let's talk about the guidance around that and how effective that is.
Sure. So right now, the recommendation is to we administer the Jynneos vaccine, and it is administered intradermally, meaning just under the skin. It's a small dose, and it's a 2-dose regimen. The second dose is administered 28 days after the first dose, and it's administered on the inner forearm.
with the COVID vaccine, I know we're in the booster phase right now. Is that the same thing with the monkeypox vaccine? Do you get the first dose and the second dose? And is there another or booster that you have to get once you've gotten the first two shots?
Great question, Ms. Page. Right now, it's a 2-dose regimen. And so it's an initial regimen. And so after you get your second shot or administered the second vaccine, right now, there's not a recommendation for a booster in this particular outbreak.
Okay, that's good to know. Just want to stay on the vaccines a little bit more because I have questions.
Okay.
Is there any pain or any symptoms that come along with getting the vaccine? Again, I think a lot about my COVID experience. And when I got that COVID vaccine, my arm was sore. So is that the same with monkeypox?
Another great question. Some common things that happen with an intradermal vaccine is redness, swelling, a little bit of discomfort at the site where we administer it. For some, it's gone in about, a few days. For others, it can last up to 2 weeks or more. Not very often do we hear from people that are overly concerned or have those side effects, but those are similar to things that you would hear with any vaccine. That local reaction is what we refer to it as.
Okay, thank you. Again, I just think about the last pandemic that we went through, and I'm like, these are questions that I have and things that I experienced. So I know if I've experienced it, the people watching, they have the same questions. And remember, if you do have any questions, this is a fluid and open conversation. So feel free to drop your questions in any of the chat boxes and we will make sure those questions get answered. If somebody wants to find out more information about where they can get the vaccine at and how they can do that, where can they get that information at?
They can do a couple things. They can go to our website. There's lots of information about MPX there. We also have a mailbox, mpxinfo@montgomerycountymd.gov. We also have a call center, as I mentioned earlier, if someone needs assistance with whether it's a question or getting care, and that number is 240-777-2982.
Really quick, the availability of vaccines, I know that it's only for certain populations at this point, but at one point in time, just watching the news following the vaccinations at first, it didn't seem like there were enough available. So how long will vaccines be available? Is that something that we're going to have to worry about?
So I don't have an exact answer. That's another great question. Initially, vaccine was very limited. It is still somewhat limited, which is why the guidance is providing it to those groups that are at highest risk. And so I can imagine once vaccine is more readily available, we'll receive guidance about perhaps expanding the criteria for those people that are eligible.
Okay. And one more time, because I know we have people that are just now joining, can we talk about who is at highest risk for monkeypox right now?
Yes, and so the highest risk groups are people with confirmed or likely have been exposed to an individual with MPX, as well as persons with multiple or unknown sexual partners. And again, priority is given to those groups that are highest risk and those that have suppressed immune systems.
Where can people go in the county to get a vaccine?
That's a great question. And I think I'm going to hand that off to my colleague, Mr. Melvin Cawthon, and he will give you some information about where to go and how to get an appointment.
Thank you. I just put information in the chat. It's kind of a step-by-step of how you get to our pre-registration page. And it also includes the phone number for anyone who needs to call. But before I kind of dig into that a little bit, I just wanted to just take a couple of seconds to go back over the kind of history of that Montgomery County has gone and giving out the vaccine. We started at the end of July. At the beginning of August, the early vaccine was given out through our STI and our HIV clinics, since gay men, bi men, men who sleep with men were hit particularly hard there were a lot of folks that we see, and we wanted to make sure that the folks that we see got the same opportunity to get the vaccine as folks who may have a better networking system. So we actually made calls for anybody who's been in our clinics for the last 18 months to make sure that as best we could, the Black and brown folks had equal opportunity. And so by the end of August, we had a pre-registration page, and the demand had grown so great that we could no longer keep it in our clinic. So we now have a couple of nursing teams who are working 5 days a week, somewhere between 8 and 10 hours a day. Early on, that pre-registration list was over 3,000 people. And so it just grew and grew, and it became overwhelming for us in our clinics. So over the course of August, September, we've worked our way through the list, getting the vaccine out to people who were at greatest risk. There was high demand from those populations. They, in a sense, were beating the door down. So it was really important that once the intradermal started, it gave us a lot more of which to do. And so we worked. And now basically anybody who was a part of those groups who wanted it are able to get it. Again, either by going on the website, the pre-registration lists are at the bottom. They're all in various languages, and also the phone number. And the way that we look at it, it may not be directly impactful for anyone on, but certainly if folks have brothers, sons, uncles, friends who may be in one of those high risk areas, it's not just limited to LGBTQ community, that anyone who is at higher risk of contact could be eligible for it. We encourage everyone to use the pre-registration form. There is plenty of vaccine available. We have plenty of clinics that are going on. There's still room for folks to get in and get an appointment. As Kimberly said, there are two doses. They get the first one, they'll get a reminder for the second one. And so we're kind of going through the large grouping of second doses now. And then our goal is to not stop there, is to continue to look for those folks in communities who still may have not heard. I know that kind of once monkeypox, the demand kind of went away from those major groups, doesn't mean that we stop. And it doesn't mean that it's not necessary or needed. So it is still kind of our responsibility as best we can to get it out still to those Black and brown communities who may not have heard about it, so folks are still, in a sense, being infected. So it's our responsibility to handle that. We've got plenty of room. So we invite everyone who wants to, knows anybody who can, to pre-register. We'll get them taken care of.
Question, if I pre-register, how long from the pre-registration period will it take before I can actually get in to actually get that monkeypox vaccine?
That's a great question. In fact, we were talking 2 months ago, 6 weeks ago, the answer would be different. If you pre-register tonight, within, I believe, 24 hours, certainly no more than 48 hours, you will be contacted, you'll be sent a link, and now the links are kind of good for the whole week. Let's say today is Monday, you got a link tomorrow. You would then have the rest of the week to go choose the day that was more convenient for you and the time that's more convenient for you.
We've talked about the high-risk populations. Let's say there's somebody, they are high risk, and they also have like a son or a daughter. Should that child come along with that parent to get vaccinated as well, or should it just be the parent who's in the high-risk population?
That is a very good question. I'm going to kick that one back to Kimberly because that's a more medical question. So my job is to get the shots. And so kind of whoever, in a sense, that they give to me, then that's what I'll do.
Okay.
So thank you, Mr. Coffin. So that's a great question. Of course, going back to the groups at highest risk, the parent who is eligible for the vaccine, meaning they are someone that has been exposed to an individual with MPX, likely exposed, or have had the multiple sexual partners, they would be eligible to receive the vaccine at this time. If they bring their children, we would likely speak with the parent and determine whether or not those children are within those groups. So it would depend on that. So that was a great question.
Thank you for an amazing answer. Another question for you, Dr. Townsend. Did the monkeypox vaccine discovery follow the same testing trials as the COVID-19 vaccine?
Now that I'm not sure about. This is not exactly a vaccine specifically for MPX. It is a vaccine for smallpox, which is in the same family as MPX. And so there were actually 2 vaccines that were approved for the prevention, AKM 2000, and of course, the Jynneos that I mentioned earlier, which is what we administer. So there have been some trials, whether they're very similar to COVID-19 trials. I can't speak to that. Perhaps Dr. Bridgers would be able to speak to that.
Sure. Thank you, Ms. Townsend.
Passing it over to you.
And thank you for that question. Dr. Myers touched on it earlier. The Jynneos vaccine, as well as other vaccines that were treated for smallpox and other illnesses, as Dr. Myers indicated, and he can add to this, that the vaccine has been around versus the COVID vaccine, where it had to go through the clinical trials, where it was a novel or a new virus, where it had to be made, if you will, in layperson's term. The efficacy of this vaccine has been around and has been used before, so it has been proven effective. So we were able to quickly deploy it. The challenge with this vaccine for this particular outbreak was that we didn't expect it to hit as fast as it did. So we had to rely on federal resources to get vaccines from the federal level, from their strategic national stockpile, so that we can get vaccines in the community. Once we were able to get the vaccines in the community, demand lessened. There was a question in the, if I may, Ms. Page, there was a question in the chat box about stigma, similar to COVID. Since we use COVID as a framework, we created an equity and access framework. We have our great minority testing partners, our Latino Health Initiative, our African American Health Initiative, our Asian American Health Initiative, and we use the resources. We leverage the resources in the community to get those doses in the forearms or in the arms if it's COVID, so that we can get folks vaccinated and have more protection. And so there's always stigma associated with anything that's new, with anything that's outside the norm. And what we've learned from experience in our Black and Brown communities, those communities that are at risk or at the greatest risk, as Dr. Myers indicated, are those individuals who are underserved. So one of the things that we did was we use an integrated model. So to lessen stigma, we didn't have standalone clinics. We integrated them in our COVID testing and our other clinics that are available in the county-led clinics. Our providers also have access to vaccines, which we were able to not only share initially, but work interjurisdictionally with the District of Columbia, with Baltimore City, with Prince George's County, in those areas where we saw higher case counts, because we knew that the data indicated that folks were traveling and individuals may have been exposed, individuals may have been traveling to other jurisdictions. So we talked, we used the science and the data similar to what we did with COVID, so that we can suppress and mitigate any further transmission of monkeypox or MPX or Mpox. And we still continuously do that now. We have conversations like this to destigmatize any concerns, to answer those hard questions that you've asked us this evening about access and equity, and does it hurt? And will I have the same effects? So these are some of the strategies that we've used to lessen any apathy, any hesitancy, any concern. And we want to continue to have these conversations. So the vaccine has been around. The efficacy is high based on the data and the science that I've read, and any peer review articles. Dr. Myers, correct me if I'm wrong, but I think that, the difference is the Jynneos vaccine was not newly developed. It's been in the community for a while. Providers, doctors, clinicians have had access, unlike the COVID vaccines, where we saw 2 pharmaceutical companies, then 3, and then a 4th one to be developed. So the efficacy, we spent a lot of work delving into the efficacy and the impact that it may have on the community. We didn't have to go through those extensive means because the data and the science had already proven it to be effective.
Yep. And yeah, if I could just chime in and say that yes, it is effective. So the smallpox vaccine from past data from Africa suggests it's around 85% effective in preventing monkeypox. And so yeah, there we go. And as you said, for the COVID, it had went through emergency authorization, and this did not have to do that because it's been around for a while.
Thank you for that clarity. Question from one of our viewers right now, and they said they are not clear on the response to the question: if an older adult has to receive the if an older adult has received the smallpox vaccine years ago, should they still get the vaccine if exposed? And Dr. Townsend, I will let you take that away one more time. So if an older adult got the smallpox vaccine years ago, do they need to get that monkeypox vaccine if exposed to monkeypox?
So I'm actually going to toss that to Dr. Myers, if you don't mind, Dr. Myers.
Yeah, no. So if they've been exposed, they should not need to get the monkeypox vaccine if they've already received the vaccine before.
So if I get monkeypox, and let's say I'm not an older adult, I'm in my 30s, I get monkeypox, do I still need to get the vaccine, or is there like a time period between when monkeypox has been said and done to when I need to get that get the vaccine?
And we just want to clear this up. It's not the monkeypox, it's the smallpox vaccine that we're referring to. It's not necessarily monkeypox.
Okay.
So if someone has symptoms or they've already had MPX, it's not advised during this outbreak to get another vaccine. So we often are asked, I've gotten one vaccine and I've become symptomatic. What should I do? You would go to your healthcare provider to get an assessment. And if you are then diagnosed with MPX, then it is not advised at this time for you to go ahead and get the second vaccine.
Okay. If you've never had the vaccine and you contract monkeypox, should you still get the vaccine, or is that wait until monkeypox is cleared?
Good question. So once you've had monkeypox, it's, understood that you have some immunity, so you would not be eligible to receive the vaccine.
Is there a time span? I know with COVID, they say give it 90 days. Is it the same way with monkeypox, or is it you're just not eligible?
So right now, there's some things that we don't know about the vaccines, such as how long the immunity lasts. We do have some information that suggests 2 weeks after the second dose, you have the highest amount of protection. Right now, there's not a recommended booster, to my knowledge.
Okay. Thank you. Another question in the chat: is the vaccine going to be available to everyone who wants to get it?
Wow, these are great vaccine questions. So right now, we are vaccinating those at highest risk. And I know I've said that several times, and this is because when we started giving vaccination, the criteria were different. And as vaccine became available, we've been able to expand the criteria or the group of people that we're able to vaccinate. So, we're moving in that direction. I can't give a definite timeline, but as vaccine is available, as we know more about who's impacted, we hope to be able to provide that to anyone who would like to get it. And just piggybacking on what Mr. Cawthon said earlier, we do encourage people, if they're interested, whether they think they're eligible or not quite eligible yet, to go ahead and go to the pre-registration site, because we do have that information, it helps us know who's interested, and it helps us know in terms of future vaccine orders, how much we may need to provide that for our community, for those people that would like to be vaccinated.
Thank you, Dr. Townsend. What is the youngest age that somebody can get a vaccine? And is there an age cutoff? I think that's very important for our viewers to know.
So right now we're under emergency use authorization. So it's pretty clear, you know, we have some guidelines for 18 and older, and then younger than 18. When it comes to the very young ones, we usually consult with the pediatrician, especially if they're less than a year. We have had some younger teens or young children that have had close skin-to-skin contact with someone that has MPX. That's a conversation with the parent and the pediatrician, and under those circumstances, they may be eligible.
Okay, thank you for answering that. Question to all of the panelists. We have seen monkeypox numbers in the Black community at an all-time high, especially with Black males. Why are numbers higher in the Black community with Black males?
Well, I know just clinically from what I've seen, a lot of it does have to do with the routes of transmission. And transmission and passing on of the disease, because it is passed on via close contact, person-to-person contact, and in that contact, because the sexual contact with men involves close touching as well as with others. I don't know the origin of that, but that is why it has continued to populate among clinically among that population.
Just wanted to, I guess, add to that of what we've seen on the administration side is that early on, there were networks that the word got out pretty quickly that literally kind of moved to the front quickly. We saw it in DC. We saw it early on in Montgomery County. That's why we were trying to balance it out by even making calls ourselves. But I think that might be one of the things as well, that the early networks that got it, passed it on. And I think a lot of our, some of our Black and Brown communities who weren't in those networks didn't get the messages as quickly. And so we have seen that they've come along, that they've caught up, but that earlier surge were networks where we clearly saw it was literally the needle moved to one side. And so my guess is that it was messaging. I just want to go back to stigma just for a second, if I can. What we also saw, again, in the county, we wrestled with on our press releases, we wrestled with the language, making sure that we did not choose language that was going to stigmatize anybody else. The community that it was in have already had a history of feeling stigmatized. So this is something that we thought about, we talked about. And it was a kind of a balance that we had to do, because we had a lot of folks from that community were the ones demanding, but we wanted to make sure to be careful that in our messaging, we didn't do anything to cause more harm to someone else in the same community.
Thank you. Dr. Bridgers, did you have something that you wanted to add?
Sure, just a couple of points. Thank you, Ms. Page, for queuing in on my facial expression. A couple of things. Want to go back to pediatric cases. Just want to inform our participants this evening, also our viewers, that we haven't had any pediatric cases, although we still continue to monitor the data across the lifespan. As Mr. Cawthon indicated in his previous comments, we continue to work hard on stigma to destigmatize all of our public health actions. You raise a great question about the demographics of where we're seeing more cases. That demographic is at the state level. We're seeing more cases in men or gay, bisexual, or men who have sex with men in our Latinx community. Nevertheless, the the numbers aren't that significantly different than the community. Again, it goes back to our Black and brown community where we're seeing our highest case counts. We also know, as I indicated in my previous comments, that we know that folks travel. Folks travel interjurisdictionally. Folks were going to the District of Columbia to get a vaccine. We know that white, gay or bisexual men who have sex with men were coming to Montgomery County to get vaccinations and vaccines. We know folks travel. And so we've worked with our other jurisdictional partners, even in Northern Virginia, to create a wider access net, if you will. And we continue to do that. We did, Mr. Cawthon indicated that we started vaccinating in mid-July, but we did our research. Our research began when we had the first case in the continental US. We monitored international trends, and we started to look at our planning. We started to do an assessment, our case management of those individuals. We wanted to identify those individuals who were at highest risk, and we began contacting them. And so we worked very hard on that. We've seen some decline in cases, but Ms. Page, as you indicated, the virus is still transmitting in the community. And so we're still working very hard. And so community conversations like this help to provide valued information to our countyans. It also helps to dispel any myths or concerns. And it also provides a bit of lessons learned from us dealing with this over the past 4 or 5 months now. And so I hope that this is beneficial. But when we look at those, going back to your original ask, why in this community, we're still working through that, and we're still focused on where the numbers indicating. We will continue to focus. If it shifts to heterosexual females, then we will shift. We went through all of the points and working with our team and providing not only vaccinations, but education as well. I think that was one of the questions in the chat box. So in addition to receiving a vaccine, we want to increase efficacy. And so we want to make sure that folks understand not only the vaccine, but what they can do from preventative measures. I think that was a question. So how do we include preventative measures in our work, or messages in our work? And so we have our great partners like the African American Health Program. I know Ms. Arlie Wallace is on as well. And so we look for Dr. Myers and the Black Physicians Health Network to help us to work in our community and provide the clinical care, diagnosis, and treatment for individuals who may be impacted, or I should say, affected and infected by monkeypox.
Thank you for that. Got another question in the chat, and it reads, like it was with COVID, have you noticed some clusters, even by zip codes, of higher ratios of MPX infection in the county, or is it even across the county?
So great question to our viewers. So yes, we've noticed some clusters along the Prince George's and Montgomery County border. We continue to do zip code analysis similar to COVID, where we look at not only where we see higher case counts, but also looking at all the data points. We don't have as many cases like COVID, but we're able to work interjurisdictionally to see if there are any quote unquote hot spots, if you will, in the county. We know that individuals travel between Lower County to the District of Columbia. We know folks travel in the northern part of Up County to Baltimore and Howard County. And so we work with those jurisdictions just to make sure that we don't have any incidences of heightened outbreaks, if you will. We've done a great job managing and mitigating the spread by these efforts. And so we continue to work diligently to suppress the spread, and also looking at the data, whether or not it's across county or interjurisdictionally.
Thank
and
you.
I didn't know if that question was for me, but I just was talking, so I just finished that.
We'll definitely take it. Thank you for answering that. Another question, what prevention measures do you suggest for all ages? And any of the panelists can take this one.
Well, I think I can jump in on that. And there are a number of ways things you can do to prevent monkeypox infection. So we have similar things that are similar to COVID, such as washing your hands, using alcohol-based sanitizer after being in contact with a person or animal with monkeypox, avoiding contact with materials such as bedding, towels that have been in contact with a person or animal that's monkeypox, avoiding contact with animals that may harbor the virus, including animals that are sick or have been found dead, especially in areas where human monkeypox typically occurs. And then we also just want to make sure if you are taking care of somebody with monkeypox, you make sure that you are using protective equipment, personal protective equipment.
Thank you very much. You mentioned animals with monkeypox. I have a dog, and I know this is one of the things that we talked about during COVID is the possibility of the virus being transmitted from a dog to a human or pet to a human. So is that the case with monkeypox? I know a lot of pet moms and dads out here that it's a topic of conversation.
It is possible, and in those cases, if you have been exposed, you want to go ahead and get a sitter for your pet. You put your pet away during that time.
Thank you very much for answering that. Again, like I said, this is a fluid conversation. So if you have questions to all the viewers, be sure to drop them in the comment box so we can get these questions answered. We want to make sure that you leave informed and educated and that everything that you need to know, that you know. Before we close things, really quickly, just want to get some lasting thoughts. Oh, we have another question. I love that. Is there any information that indicates an increase in mental health issues associated with a diagnosis of MPX? That's a really good question.
So that's a great question. I will try to respond, but we don't have our behavioral health team online tonight. I know in some of my community conversations, I know that there's mental stress and anguish with not knowing what to do. How long do I have to stay inside if I've gone through COVID, and what happens if I had COVID and now I have Mpox? There's a period of isolation. There's a period that I need to go. So all of those stressors can evolve. What we continuously ask folks who ask that question, great question, is to consult with your primary care provider. If you need a mental health provider, you can contact our helpline and we will try to get you some support in addition to other behavioral health services. But I'm sure that there are other things that I am not touching on this evening, but those are some of the comments that I've heard from our residents associated with monkeypox, and not only monkeypox, but COVID. And it's not specific to our healthcare providers and our clinicians. It also resonates in those individuals who they are serving as well. Because one of the things that Ms. Townsend didn't mention or hasn't gotten to yet is that we have a phased approach. And in that phased approach, we also have healthcare providers like Dr. Myers and Ms. Townsend who administer or have administered vaccines, monkeypox vaccines. And so we need to protect our providers as well. So our providers are also included in that. If folks who are watching this evening, remember we had a phased approach and we want to protect those who are helping protect others. And so as Mr. Coffin indicated, we have sufficient supply now that we've worked very diligently and in partnership with not only our community partners, but the Maryland Department of Health, and we want to get folks protected. And so all of those things come into in my mind as I think about not only stigma, but mental stress and anxiety associated with getting vaccinated.
Great question.
Yeah, and I could piggyback off the possible mental health issues with diagnosis, because monkeypox, it can be disfiguring with the painful lesions, making eating and drinking and bowel movements and things difficult. And then you have the isolation that may happen as a result of your symptoms and taking care of things. So definitely seeking mental health is going to be paramount if you are feeling anxiety or depression due to the disfigurement and or isolation that you're feeling.
Thank you.
I just wanted to, I'm sorry, just really quickly adding on to that. What we've seen is that folks, they can't work, and not everyone has either health insurance or sick leave to be able to take off. We see a lot of folks who, if they don't work, they don't eat. And then also there are folks who couldn't isolate. if you're living with a family, you may not be isolated. There weren't as many resources for MPX as there were for COVID. So where COVID, there were places that might have a COVID hotel that folks could go to. And with MPX, there wasn't always that option for folks to be able to isolate. So in addition to, and it's absolutely right, in addition to the isolation, it is the worry about, am I going to be evicted? Where am I going to get food? How can I isolate and protect my family or friends or roommates?
And I don't think we touched on this, but I definitely want to make sure that we make a point to say this. The MPX vaccine, is there a cost associated with it?
No, and I failed to mention that there's no cost. If you come to the local health department and we provide it to you, it is at no cost.
Thank you so much for saying that. I know as we've been talking more about the vaccine, that's actually one of the questions that popped up in my head. I'm like, is that something I have to pay for? And when you talk about, some of our underserved communities, one of the reasons why they don't get a vaccine or one of the reasons why they don't seek treatment is because there's a fee associated with it. So thank you for saying that. I think that is really, really important for people to know. I have another question in the chat, another great question. Are there any risks for taking the MPX Vax COVID booster and flu shot all at the same time? And any of the panelists that wants to take that one, go right ahead.
So other than the no, first off, other than the pain at the site of injection and things like that, and if you have allergies, obviously, but other than that, no.
Okay. And to piggyback off of that question, can you get all of them at the same time, or should you kind of space them out?
You should space them out, just so that so that your body can recover. As you know, for the flu shot, right? It's with some, depending on which one you get, it may cause, some flu-like symptoms, and so yeah, you just want to space those out.
Okay.
And so, Ms. Page, let me also add to Dr. Meyer's comments. In our clinical spaces, especially our county-led sites for monkeypox, COVID, flu, they're all clinical environments. So there is a wait period. You just can't get your shot and go. Or as they say, get your shot and roll out. You have to wait. We have clinical folks there. We have procedures in place to protect not only yourself, but to make sure that your visit is safe. And I just wanted to share that it is a clinical environment. So when you come in a clinical environment, you will have to wear a face mask because you're in a clinical environment. And just like if you go into any clinical environment, there could be individuals who are infectious, but not saying that they are. But one point that I wanted to go back to is that hand washing is one of the most efficacious or effective preventative measures to prevent the transmission of any virus, be it flu or anything else. Please remember to wash your hands. We've gotten away from that. It's flu season. We talk about flu, we talk about COVID, we talk about all of the viruses, but we haven't had a conversation tonight about hand washing and the effectiveness of hand washing. So 2 things: get a flu shot if you hadn't gotten a flu shot, and please continue to wash your hands as you go out, because more folks are inside now, more folks are touching high touch spaces, and more viruses are looming out there. So I wanted to say that.
Yes, 20 seconds soap and water, okay? I was told you can sing the ABC song a few times. That always works. It works for me. I love to do it. And I heard you can use happy birthday as well. I've never done that one, but I do like the ABC song because, it's just kind of fun. Another question in the chat, and Dr. Bridges, I think you kind of touched on this a little bit, about the privacy guidelines around the MPX vaccine. Are they any different from COVID?
No, it's a clinical space. Your health information is protected not only at the federal, state, and local level. So when you come into our clinic, your information is protected.
Thank you again for saying that. Just wanted to make sure again that we get all of our questions answered. There is still more time if you have more questions to drop those in the chat. Do want to take a quick second just to get Another question, have you mentioned asymptomatic with COVID? Is there such a thing? I know we did kind of talk about MPX and asymptomatic a little bit. Can we kind of touch on that a little bit more?
I'm muted. Symptoms, absolutely. So if you are not experiencing symptoms of COVID, I'm sorry, symptoms of monkeypox, then you're not going to pass it on. But when it does come to monkeypox and infection, the symptoms begin like a fever, headache, muscle aches, exhaustion, which appear 5 to 21 days after the individual is infected. Often within 1 to 3 days of the onset of fever, infected individuals develop a rash that can look like pimples, sores, or blisters. And the rash may appear on the face before spreading to other parts of the body, including the hands, feet, and genitals.
Okay. So if I'm asymptomatic, I am perfectly okay to go outside and mix and mingle with people.
Yeah. Well, so if you're asymptomatic, but you've had exposure, then you want to go ahead and pre-register.
Okay.
Yeah. But if you're asymptomatic and you're not having any fever or anything like that, and you haven't had any exposure, then yes.
Okay, thank you for that clarity. Again, anybody watching, if you have questions, feel free to drop them in the chat. Definitely want to make sure that we get these questions answered. A lot of great questions are coming through right now, so definitely keep them coming. Really quickly, just want to get a thought from everybody about what we as a community can continue to do to make sure that we stay up on what we need to do when it comes to MPX, and how we can help with to stopping the spread of MPX. So Dr. Myers, since you are still on, I will get you to start.
Well, yes, yeah, so, I think it's just still about vigilance, as Dr. Bridgers said, washing your hands, making sure that we are doing all the things that we were doing during COVID to stay healthy. In addition, if you are in an area where you do have exposure, please do go ahead and use the resources to go ahead and pre-register yourself so that you can receive the vaccine and the resources that are available. We have tons of resources available via the Montgomery County website for you, as well as the CDC website, as you know. We are available. We have a call number, as well as Twitter and social media for use, as well as just contacting us. We are always available.
Thank you so much, Dr. Myers. Dr. Coffin, any lasting thoughts that you would like to give? One, to stop the spread, and then two, to make sure that we stay on our P's and Q's.
I'm going to go maybe in a slightly different direction as far as I think it's important that we keep talking about it. As far as we keep talking about it, I mentioned earlier that it seems to be waning a little bit. It's important that we don't allow it to wane while it's still here. And the example I gave earlier that we saw early on, there were communities who got the word out. And they came in abundance. I think it's really important in our messaging that we talk in spaces that we may not be in, whether it's church communities, whether it's social communities. That's where I think it's really important that the messaging get out. It might not be for us, but it may be for someone else. And so I think by not talking about it is how we keep the message kind of really contained. And really important, this doesn't just affect one community. It doesn't just affect one community. In a sense, it affects folks who, from any community, who are kind of being really active and who might have those risks. I think it's really important that that message keeps getting out as well.
That's a very good point. Keep the conversation going. It doesn't need to stop right here. It needs to continue. So thank you so much for that. Dr. Townsend, same question to you. What can we do as a community to stay on our P's and Q's and to stop the spread?
Well, I agree with what Dr. Myers and Mr. Coffin have said. Just also with Dr. Bridgers has said, hand washing, basic infection control measures. And even if you've been vaccinated, continue to take those preventive measures to help us keep from spreading MPX in our community. So, and of course, the conversation is important. We're here as your resource, as one of your resources. And so please don't hesitate to reach out to us, go to the website. We even have people walk in and just say, I would like to talk to someone about it. We practically run downstairs to the lobby because we love to do that. We love to educate our community and interact. And so please don't hesitate to do that.
Thank you so much, Dr. Townsend. Dr. Bridgers, same question to you.
So talk about it and be about your health. That I cannot say it any plainer than that. We need to talk about our health. We need to talk about those factors in our community that impact our health, because as we've seen in COVID, as we've seen in monkeypox, what happens in one community can and often will occur in another community. Mr. Cawthon, Dr. Myers, and Ms. Townsend talked about it, shared with their closing remarks. So I will leave everyone with that. Talk about it and be about it, and share information. Don't hold on to the information. And yes, we've posted, I know that there was a message in the chat that popped up. We have flyers, we have information in the community, we have information in multiple languages. We know that Montgomery County is a diverse community, and so we want to get out all the information. And if we aren't getting the information out, please let us know, because there may be spaces that we haven't, or we are so focused on getting multiple messages out that we miss one community that we often don't talk about it, and our healthcare providers and professionals on the town hall tonight, is we don't talk about our Native American community. It impacts all communities. And so if we're not reaching in a community, we've left numbers for our call centers, for our information assistance line. Please let us know so that we can get those messages in the community. Be about it and talk about it.
Yes, simply put, be about it, talk about it with everybody that you know. That's how this works. Okay, you just can't have a conversation with yourself or with your best friend. When you see somebody in the community, have that conversation with them. And if you realize, like Dr. Bridger said, that you know what, that may be a population that hasn't been served, then let's serve that population. Okay, we're in this thing together, and we're going to get through this thing together. So to all of the panelists tonight, thank you so much for taking some time out of your evening to really give some gems and some jewels on the information that's surrounding monkeypox. I know there's still a lot of questions out here, and if you are watching and you're wondering, like, hey, where can I get more information? Where can I talk to one of the panelists at? You can do so at www.montgomerycountymd.gov/MPX. Again, that is www.montgomerycountymd.gov/MPX. Again, we are all in this together. We are going to get through this together. Have a phenomenal evening, and thank you for joining.
Thank you.
Gonna wait a couple more seconds, folks. Thank you to our ASL interpreters. You guys can drop off. This was great. I was just trying to get a quick conversation with the panelists, but I can't quite tell if we've got participants still on or not. But I just want to say thank you very much to everybody. Thank you very much to Jackie. I thought this went really well. It seemed really nice and flowed like a conversation, which I know is what we were planning. And I think the viewers really like that. There weren't questions on the Facebook Live, but there were several comments, very informative.
Recording stopped.
Thanks. And yeah, I just want to say thank you. Again, to everybody, and thanks to all the Office of Community Partnerships folks for helping us get the word out, Arlie and others. And with that, I think we'll say goodnight, and everybody have a nice rest of your evening. And again, thanks again.
Thanks, guys.
Thank you all.
Have a good
Thank you.
one.
Thanks,
Thank you
everybody.
so much. Thank you, Dr.
See ya.
Myers. Thank you, Arlie, although you didn't turn on your camera. Thank you so much for joining us tonight. I'm just going to call you out and put you on blast. We appreciate all the work you're doing with the African American Health Program, its partnership, and thank you for having Dr. Myers support us. You guys are really great, and I use guys kind of non-generic, non-gender based. Let me just put that out there, but just saying thank you so much. All right.
Thanks a lot. We appreciate it. Anytime you ever want the help with the African American Health Program, you all know all you do is just call me, and we will be here to support.
Yeah.
Thank
All
you all
right.
very much.
Thank you. Thank you.
Okay.
Thanks
Bye-bye,
again,
everyone.
everybody.
Good night.
Good night.
Bye-bye.
Thanks, Mary.
Thanks, Mary. Thanks for
Thanks,
all your hard
Mary.
work.
Thanks, Mary. And Miss Page, thank you very much.
Thank you.
Absolutely. Thank you.
And
Thanks, Miss
Melvin
Page.
and
Nice to meet
Kimberly.
you.
Okay, then. Take care, everybody.
All right, y'all. Bye-bye.
Bye-bye. That's why I tried to move you out.